All right, so good morning, everyone.
Good morning.
We are here today with one thing in our mind, and that is the fact that this community needs an acute care hospital. That communities in the south suburbs and the south side of Chicago need access to a vibrant community hospital that serves all areas of care, from birth, cancer care, pediatric care, everything. And so we are here today to call on our governor, to call on the Health Systems Review Board to deny their petition for closure. They have not been honest, and we are here to say that it is not time to close MetroSouth Hospital. So to start us off this morning, I have Gwen Stanley. She is a member of the MetroSouth family and serves as a housekeeper.
Thank you all for being here for our press event and rally to save MetroSouth. My name is Gwen Stanley. I have worked at MetroSouth Medical Center for 14 years in the EVS department in the behavior and mental health department. All my fellow MetroSouth workers are very upset and deeply frustrated that we must be here today to save MetroSouth Medical Center. The hospital is essential to our patients and our community. No one in this region wants to see MetroSouth close. This corporation healthcare system has never cared about creating a stellar hospital to serve our community. Quorum Healthcare doesn't see the faces right here today. They only see dollar signs. That's why Quorum Healthcare has begun shutting down MetroSouth before they even had the authority by the state to do so.
Agree.
Quorum, like so many other greedy corporations, simply choose to ignore the rules and the law about how a hospital is supposed to wind down. They also deceived and manipulated everyone. Clearly, Quorum never had any real intention of selling or finding another operator to take over MetroSouth. They knew it, we know it. And it's time that the Illinois Health Facility and Service Review Board, which regulate hospitals, hold them accountable. We are calling on the Health Facility Review Board to postpone their meeting on September 17th to decide the fate of MetroSouth. The board needs time to gather the facts and evaluate whether Quorum acted improperly and potentially violated the law, which they began to shut down our hospital before getting authorization from the state. The question is, does Quorum Healthcare think the rules apply to them? I love my job. I care deeply for the patients whom I serve. That's not the case with Quorum. They have no compassion for our patients and what it means to lose access to health care and emergency services. Everyone, our workers, the nurses, the doctors have told Quorums directly that people would die because of their decision to shut down MetroSouth. The patients who suffer from a stroke, a heart attack, a car accident, or even a gunshot wound will have to travel farther and be at greater risk. Like I said, I work in the behavioral health department, and those people are just heartbroken, just the thought, because they love the care that they get and they love the area and everything. Oh, I'm sorry. Okay. Relationships matter when dealing with behavioral health. Quorum knows all of this, but they simply choose to look away. Our community needs and deserves a strong and thriving and accessible hospital. That's why we are all here today to save MetroSouth, because we know what the stakes truly are. Thank you.
Thank you, Gwen. There are 814 employees who, when MetroSouth closes, will no longer be employed. 814 people who used to serve the city of Blue Island and the surrounding area to provide quality health care. Next, we have someone who provides quality care every single day to the community. I have Dr. Guillermo of Maternal and Fetal Medicine.
All right.
Okay. Last name is Font, F-O-N-T. So thank you for the opportunity to speak in behalf of our patients and myself. What I want to share with you is that the unit that we run, the labor and delivery unit that we run at MetroSouth is a unique unit. We provide advanced obstetrical care in this community and surrounding communities. There's no other unit like this one close by, and we currently last month delivered about 111 patients, and we're still busy. We have been delivering about 1,400 babies per year, and while other places their numbers are decreasing, our numbers have been increasing. So I think that the elimination of this unit will probably create a desert in healthcare, and we're probably going to see some increase in maternal and newborn complications because of the absence of the services. My opinion is that we have to work hard for this unit to stay open, for the hospital to stay open so they can provide other cares. And we have to work with the politicians so they can basically mediate and find a buyer for this hospital. Thank you very much.
All right, so thank you. One of the most important things we have in our back pocket right now is elected officials who support this hospital and support this community. So I'm going to turn the mic over to Representative Bob Rita.
Hello? I don't know. We'll try to get some sound here.
Yeah, turn it up.
You know, today
There we go.
we've done a number of press and brought the community together on this closure. What we're witnessing is corporate greed. I've sat with Quorum, and they keep saying that they have potential, they've been seeking potential buyers, but all they've been doing is lying and not telling the truth.
Right.
So today I stand with the workers of MetroSouth from SEIU, the doctors, the nurses, to demand that Quorum come to the table. I'm aware that there's a couple of potential people that are interested in this hospital, but Quorum won't meet with them.
Right.
Quorum won't negotiate with them. It's about their third quarter earnings to have this hospital shut down. That's why they kept moving the date. If you go back to when they originally said they were going to close this hospital was at the end of the year, unless a potential buyer or a potential someone to come take this hospital over. Then they moved it to November 30th. Then just a few weeks ago, they moved it to September 30th, which happens to be the end of the third quarter for their corporation. It has to do with the profits over patients and people. We're witnessing, again, corporate greed about people just looking at dollar signs and not caring for a community or its employees.
And patience.
The patients in the surrounding community, not only Blue Island, need this hospital. It was stated at an earlier event that almost 50,000 emergency room visits come to this hospital. There is no way the surrounding hospitals could absorb that with the closure of MetroSouth. I stand here, we've been trying to work with the governor's office and other agencies, but demand the Health Facilities Planning Board to delay this closure on September 17th. I stand with my colleagues in the House and Senate, Senator Jones, Senator Will Davis, or Representative Will Davis, Representative Justin Slaughter, along with the many mayors, Alderman Austin and Beal in the city of Chicago, to ask and demand the Health Facilities Planning Board to delay this so that these potential buyers that I've been contacted saying that Quorum won't meet with them. But I stand here with you as a resident of the city of Blue Island and a representative of the 28th district to demand the delay of the closure of this hospital. Thank you.
Senator Emil Jones.
Thank you, and good morning. I stand with you, the workers of MetroSouth Hospital. I was one of those 50,000 emergency patients this year because I suffer from asthma. And the care that I got at the hospital could go without saying. I walked out there with a brand new pair of lungs, needless to say. But I was also, this hospital is very, very dear to me. I was born in this hospital 41 years ago. So I know the care and the potential that this hospital has. Like my colleague said, Rita, it's all about money. It's all about money. I have been through this with other hospitals in my district, and those hospitals want to remain open. They want to remain in the community. So they did certain things working with the elected officials to stay open. I don't get that here at MetroSouth. I got one call from the CEO, and that was to say we're closing. That's it. I don't get any return calls. It's not the same effort because they don't want to be here. So like my colleague said, there's other people that are interested in coming to buy this hospital. Well, you need to sit down with them and make a decision so we can keep our hospital open. Last but not least, last year when we was working on the assessments, many hospitals pay into a system so they could get money back from the state and federal government. The numbers that MetroSouth have will qualify them to be a safety net hospital, which means they would get additional dollars. For some reason, they didn't want to be labeled as a safety net hospital. Right. They didn't want that I guess, stigma of being a poor hospital. You're not a poor hospital if you're a safety net hospital. It just tells the type of patients that you see. And they numbers met those qualifications. We in the state could have helped MetroSouth Hospital in this last budget if they would have let us, but they didn't. So I stand with my rest of my colleagues and all of you SEIU that they delay the closing and they come back to the table. I also call on Governor Pritzker to help us out. We need your leadership at this point right now. So we're not going to let this hospital close. Even we have to stand here in front of the doors and not let them walk out. So we need all of you all support. I want to thank all of you all of my colleagues, Alderman Alderman, Alderman Bill, Justin Slaughter, and Representative Rita for trying to put our heads together what we can do to make this happen. So again, keep up the fight. We'll see you soon.
All right.
All right, Representative Slaughter.
The work? Okay. Let's get some life pumped into this. When I say we will, you say rise. We will. Rise. We will. Rise. We will. Rise. That's right. We're here today to fight for our hospital, to save our hospital. This is something that cuts deep into our community. I just want to highlight two things. We've already highlighted them. This hospital employs over 800 hard-working employees. We stand in solidarity with our brothers and sisters from MetroSouth and from SEIU Healthcare. The other thing is that we know that this hospital services people of color, working families. These are communities that have been traditionally disproportionately impacted by chronic health illnesses. So we need accessible healthcare, accessible hospitals, and what we don't want is a hospital desert. Whether it's Alderman Alston and myself and Senator Jones fighting for Roseland, whether it's Representative Rita and myself fighting for MetroSouth, it's extremely important that we have critical quality hospital services available to this community. And so we stand in solidarity. We're going to keep on fighting, and we will rise. We will rise. We will rise. That's right. I'm Justin Slaughter, Illinois State Representative of the 27th District, representing the far south side of Chicago and the southwest Cook County suburbs. Thank you.
All right.
Alderwoman Carrie Austin.
Woo!
Oh, what can I say after my elected officials have spoke? But I do like what Senator Jones says. We'll stand in front of the doors to keep them from closing. I do like that part because we must demand asking. We've already asked. We've already been congenial to them. So now let's demand. And if we stand in front of the doors and say, you will not close MetroSouth, like Senator Jones, State Representative Rita and I, and Slaughter, we have to do the same thing for Roseland. I don't mind a good fight. What about you? So if we have to have a good fight to keep them from closing MetroSouth, we can do it. My residents come to this hospital. I can't say I was born here, that's too far back. But I can say one thing. My residents come to this hospital. And that's the important part for me in the city of Chicago, that they have health care. Because if you can't come here from Roseland Hospital, where you going to go? Because if you're in a critical condition, I guarantee you, you're going to die before you get there. So we got to change that. We have to change that narrative and let them know that we will rise.
Come on.
Thank you, Alderwoman Austin. This is an issue that is being fought on all levels of government. So, Mayor Vargas?
Yes.
Yeah. Come on, man.
Good morning, everyone. Good morning, Blue Island. Good morning, the Southland. That institution that's behind me, 1905. We're not going to let it die. We're going to let it live. They will never forget us. Corporate America will never forget us. We're a community, a tightly knit community. Look around you. White, black, the whole rainbow is here. We have our elected officials. They're all here state. We're asking the governor for assistance. We need everybody's assistance. We won't leave until, we won't allow them to close those doors. Guess what, if we can, maybe we should go to Tennessee where the CEO lives and knock on their door and say, how would you like it to close your hospital? We have a dedicated staff who's standing behind me and people who are working right now as we speak in that hospital. They put their lives, their careers, their families on the line, and we're not going to let them down. We're surrounded by many communities. We have mayors here who are very supportive. We've gotten, at a minimum, 14 mayors who surround the community around here. This is not a Blue Island issue. This is a Southland issue. This is an American issue because it's a hospital issue. As State Representative Rita mentioned, 50,000 patients have used that ER room. Where are they going to go? By the time they go to Ingalls, they'll be dead. By the time they go to Christ, they won't allow them in. Roseland can't take it. So that's what we got to do. We got to think about this. This is a centralized hospital. All roads lead to Blue Island. All roads lead to MetroSouth. And let's put it this way. We can probably get rid of the name MetroSouth. Let's call it the community hospital. It's a community hospital. And it is true, as our state rep has stated since day one, there's been buyer number one, there's a buyer number two. They don't want to meet us at the table. We got to force them to meet them at the table. Tell them, you know what? Take it or leave it. Get out of Blue Island. We'll got somebody who's willing to take over this hospital. As our state rep has mentioned, it's corporate greed at its finest. We got to let Wall Street know we ain't standing. We're holding tight. We're not going to let them close this hospital. I need your assistance. This is rally number one. We got rally number two on September the 14th. This hospital's been very innovative since day one. Cardiac, stroke, prenatal, high-risk pregnancies. This hospital can and will be again a light not only in our community but in America. This can be a hospice, veterans, specialized hospital, whatever it is. We need an ER room on the south side. And as Alderman Bio said, we get patients from Chicago. We reached out from Chicago all the way around, so this is what we need. So I need your assistance. We will what? Rise. We will what? Rise. We will what? Rise. Even if we have to go to Tennessee. Thank you, everyone, for coming out.
We'll get there.
All right, so Apostle Jones, invite you up to say a few words.
Well, praise the Lord, everybody. Praise the Lord. It has been said that we need to rise. It has been said that we need to fight. But the scripture teaches us to watch, fight, and pray. And I know that the combination of those three will make a difference in this situation.
Yes.
I've walked the halls of MetroSouth to come to see many parishioners from our church, and many pastors know the hospitality of this hospital and also know the expert medical knowledge of this hospital and how many people have been saved in this hospital, along with the effectual fervent prayers of the righteous. We believe that God designed this hospital to be here to keep the hope alive and keep the families confidently believing that things will be all right. And so because of this situation that rises now, we must rise. We must rise with our hearts, and we must rise with our faith. And we must learn how to do three things at one time. They say when you are ambidextrous as well as when you're able to be multitask, you can do more than one thing at one time. So let's watch. Let me hear you say watch.
Watch.
Let's fight. Fight. And then let's pray. For God will give us the victory.
Thank you for those words. My name is Igoe, and I serve as our Vice President for SEIU Healthcare for our hospital division. We represent the members here at MetroSouth Hospital, and to be a broken record, we are calling on the governor. We are calling on the Health Systems Review Board to deny their application to closure. They have not been honest from the gate. They formed Quorum Healthcare, taking all their high Medicaid hospitals and putting them all into a subsidiary company. Suddenly, all of these hospitals are making the decision to shut down. This is a for-profit company that has said we are no longer in the business of providing health care to those that need it the most. And that's not right.
That's no way. They never did.
There is a problem with healthcare. There is a problem with for-profit healthcare. There is a problem with how our hospitals are funded in the state. There is a problem with hospitals shutting down. Healthcare deserts are a real thing here in the state of Illinois. We can't afford to go 3 miles. We can't afford to go 7 miles to the closest ER.
No, ain't gonna make it.
So we will end today's rally with a chant of "We'll be back," because this fight is not over. We'll be back. 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 We'll be back.
We'll be back. Don't forget September the 14th.
September the 14th. We will be back right here.
Right here.
9 a.m. September the 14th. We'll be back here. We'll be strong with members of the community demanding that MetroSouth Hospital rescind its application.
We will rise.
Is there a question?
Yeah, is it true this company's already moving out the cath lab and trying to move out the future as we
Yes.
speak?
Yeah.
That's not right. That's got to be illegal. Come
That's
on.
what I said. They're closing all the units. Half the staff is gone. Not 10%, about 35.
That jeopardizes the patient's care. We've got to keep this hospital going. I mean, come on. Why are we letting get away with this? Moving it out while we ain't even got...
There you go. We're not even closed yet, and they're moving everything out. 3 units are closed already.
We urge everyone to call the governor, call all your elected officials, and tell them to deny their application for closure.
Good.
Save MetroSouth!
Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! Save MetroSouth! All right.
Anybody else have any questions?
Thank you all for coming today. We will see you 9 a.m. on September 14th.